My name is Tony DeBose. I'll be giving a presentation on syndrome of inappropriate antidiuretic hormone secretion and the causes and treatments of it, as well as symptoms, nursing interventions, and how it's diagnosed. So what syndrome of inappropriate antidiuretic hormone secretion is when excessive levels of antidiuretic hormones are produced in the body. Antidiuretic hormones are seen in the kidneys and the body to conserve the correct amount of water. If this condition is seen, the body will retain water, and certain levels of electrolytes will fall into the blood, such as sodium or potassium. What causes this condition is very rare in children, so it is seen mostly in adults with heart failure. And certain lung cancers can also cause this. Many different conditions, brain tumors, head trauma, encephalitis, meningitis. If there's damage to the hypothalamus or pituitary gland, the thyroid and parathyroid, any hormone deficiencies can also cause this condition. If a patient has HIV, it can also be caused, and hereditary. So if mother and father have it, the baby has a high likelihood of getting it. Symptoms that patients are seen with are nausea and vomiting. They can be depressed or irritable. They may have memory impairment, hallucinations. They can be combative or confused. They can also have seizures, and in most complicated cases or complications, the patient can be in a coma. So symptoms of this condition, it may resemble other medical conditions, so always consult your doctor for a diagnosis. How it is diagnosed is by a complete medical and physical examination by a primary care provider. Blood and urine tests will be performed. This will measure sodium, potassium, and the concentration of the solution in blood and urine. If the test is positive and the blood and urine tests show this condition, treatment will be based on how the doctor and the patient would like to proceed, but it is based on your overall health, your age, and medical history, the extent of the disease, so if it's chronic or not, tolerance of medications or therapies, and then of course how the patient would like to be treated and their preference to it. They will get many different options, but the most common option or treatment prescribed is fluid and water restriction, because we don't want to have fluid overload since the body is already retaining water. If the condition is chronic, fluid restriction may be permanent for the rest of our life. Certain medications that inhibit the action of vasopressin, so the ADH, can be given. Surgical removal of a tumor that produces the ADH can be removed, and other medications to help regulate the body fluid volume. So a diuretic will mostly be given. Diuretic helps eliminate the extra water from the body. It'll make you use the restroom a lot. And then antibiotics will stop the growth and kill the bacteria of what is needed from this condition. As a nurse, nursing interventions that will need to be done. Priority are monitoring in and outputs of the patient, and then daily weights. If the patient's weight is higher than the day prior, they may be retaining a lot of fluid. Assess and monitor the vital signs every 1 to 2 hours. Changes in fluid can cause the blood pressure to lower or rise and the heart rate to rise. Assess and monitor respiratory status. Note any changes in respiration. Always oscillate the lungs. Oscillating the lungs will help hear if there's any fluid in the lungs. And then the provider may also order medications or electrolyte supplements to be given, mostly potassium. Supplements can be given for the electrolyte imbalance, but always careful when administering it because you don't want to overload too quickly on potassium. Monitor their lab results, monitor their potassium, monitor their sodium, their chloride, their serum concentration, and their urine. Low potassium is the main sign of this condition, so lab values are important and will determine if the treatment that is provided is effective. So complications that are seen with patients that may have low blood sodium levels, they can have headaches, memory problems such as the confusion and hallucinations. They can be depressed, they can have tremors, and muscle cramps. So they can have muscle cramps in their hands or their legs or feet. And more severe complications can include respiratory failure, if fluid gets in the lungs, hallucinations. Patient can be in a coma. It can also cause death. Some complications that this condition does, some systems that it complicates is the nervous system, the renal system, because fluid overload can damage the kidneys and cause renal failure, the lungs, the pulmonary system, and then the nervous system with the memory problems, hallucinations, and confusions.